We've received quite a bit of feedback on this one. Last night, Target 8 showed you stunning cost differences in healthcare, and viewers are speaking up.
Oh, yes, they are. We showed you how one facility can charge you thousands more for the same medical procedure somewhere else. Well, tonight we're looking specifically at how Michigan fares when it comes to making prices available to you so you can shop around.
The next time you pay a medical bill, keep in mind you may have been able to pay hundreds, even thousands less if you'd shopped around. According to healthcarebluebook.com, we discovered the cost of a colonoscopy can double from one place to the next in Grand Rapids. A chest x-ray more than doubles. And get this, a CT scan can cost you 5 times more at one facility than another.
Our system has allowed this to happen because the customer just wasn't paying attention or asking.
Bob Hughes is a certificate of need commissioner working to balance healthcare costs in Michigan. He's also a benefits consultant working with businesses on how to save money. Hughes says people got used to paying a copay and stopped questioning the overall cost, driving up healthcare prices. He says the key is transparency, so patients can choose the right care at the right price.
Your premiums next year are going to go up a lot more than they would if you were using the lower cost, more efficient, higher quality providers.
We found Spectrum, St. Mary's, and Metro all post some of their prices online. But advocacy group Catalyst for Payment Reform recently gave Michigan an F, saying our state doesn't do enough to get prices and information to patients.
If you get it for $1,900 or $7,000 with an in-network provider, do you think somebody is overcharging there? It's a pretty simple question.
Target 8 discovered United Healthcare Insurance started posting prices on its website this year. We used the site and discovered an MRI that runs just over $2,000 at St. Mary's costs more than $3,000 at Spectrum. A CT scan at East Beltline Imaging costs about $350, but it's $2,200 at Metro Hospital.
Why would I pay thousands more to go to your hospital?
Generally because of where you're having the services provided.
We took what we found to Metro Health Controller Chris Kurtz. Kurtz says you may pay less at an outpatient surgical center, but keep in mind you won't be in a more equipped hospital setting if something goes wrong. Target 8 found facilities including Spectrum, Mercy Health, and Metro may be on the high end for one procedure, but on the low end for another.
Is that something for patients to be alarmed about, that there's such a price variance here?
They should certainly do some research, probably check with their insurance plan. They can even check with the facility on what their prices are. They need to keep in mind, though, that there is some price and value and quality that goes into that equation.
Now, we have several links with this story on woodtv.com to help you compare prices right here in West Michigan, along with a list of tips on how to shop around. We are already getting a lot of feedback. So tomorrow morning at 6:20 on Daybreak, we'll have benefits specialist Bob Hughes live in our studio to answer some of your questions. You can keep sending those questions to us at reported@woodtv.com.